Hello, children of a lesser joint, and welcome to today's discussion. Today's discussion is going to be a pretty short discussion. I have a few things on the agenda that I'd like to talk about today. Number one is I'd like all of you to help me help you. That's the goal of today's discussion as topic number one. What I'd like to ask for your help with is bringing doctors to the site. You can bring other dentists, so if you're a dentist doc on the site, bring other dentists here. Or if you know a doctor that has an area of interest, a rheumatologist, an immunologist, a hematologist, let's get them to the site. Because the only way that I'm going to make progress here in educating both patients and the medical community is by having an outreach program. And I'm going to use this as at least an initial segue to be able to get my messages across. So if you can help with that, I think you'll be helping yourselves. And then I'll be able to develop a network and be able to offer solutions to patients who come from out of state, which is so important, and to have them seen by a doctor who has a genuine interest in this and is going to devote the time necessary to care for people with unusual and complex disorders. That's number one. Number two involved over here is an awful story. No one likes to have to tell a story like this. But something happened starting about 3.5 weeks ago, which I feel compelled to tell you about. Most of you, when you start getting symptoms, like almost everybody today, runs to the internet. And they're starting to look things up online and trying to figure out what's wrong with them, even before they see their own doctor. This is a story about a young man, somewhere between 24 and 26 years old, who comes into our office with a complaint of a headache. He's not my patient. I share an office with two other dentists, and one of them asked me to listen in on the story. So the young man sits down, and this is what I call an ambush case. This is where I've got about 3 to 6 minutes to listen to his story and try and put something together that will benefit this patient. And here he is. He's got a new onset headache. Never had a headache in his entire life before. He had been to both an ENT because he had some sinus issues that were concomitant with the headache, and he'd been to a neurologist. Nobody could seem to find what was wrong with him. So I asked him a few key questions, not wanting to get terribly involved, but wanting to help out with the situation here for one of the other dentists in the office. And I listened and I asked him a few questions, didn't touch him, didn't examine him, had him do a few maneuvers, and then I went and I wrote down some things for the other dentists to offer him. And one of them was putting him on an antibiotic for a sinus problem, which the ENT had not offered. And so that was taken care of, but there was a list that he needed to be reevaluated. I have a document. It was prepared about 25 or more years ago that I'm going to post on the site. And it's red flags associated with headaches. So this is what ends up happening. About a week later, this young man comes back into the office, and I said, "How are you feeling with those antibiotics?" He said, "Well, I've been feeling a little bit better, but I haven't started the antibiotics yet." Now, this is 8 days later. I said, "And how are those headaches?" He said, "Well, I hadn't had one in a while, but they're back again now. These headaches were brutal. They were debilitating." He couldn't get out of bed for 3 days. And I just kind of put it aside. And then approximately a week and a half after that encounter with him, I walk into the office this past Thursday, and I speak with the hygienist in the office. And she said, "Guess what? he had seen a neurologist, and he was told to go to the emergency room immediately, and they're doing a spinal fluid tap. I said, oh. So the dentist in the office comes over to me and said, what are they looking for? I said, well, this is going to be one of two things. This is going to be either he has increased intracranial pressure because the pressure content in his spinal fluid is too high, and they're going to drain off some of that spinal fluid to lower the pressure, or they're looking for tumor cells. He said, that's not good. I said, the first one's not bad. Second one is generally not good. Saturday we found out this young man has a spot on his lung and a mass in his brain. So he's got a solid tumor in there. We don't know any more to the story. Now, the reason I bring this up is because it's really easy for a patient to walk into the office, have a complaint of headache, because we all know that headaches are part of what we call TMD. And you can fall into the trap so easily if you don't pick it up as a red flag. A first time, new onset, severe headache, a changing headache, and you'll see there are 3 pages that I have on this list. That's an immediate referral to me. I don't want to keep a patient in my office at all with those kind of symptoms. I want them ruled out, and I want it done fairly soon so that I know that the patient is safe. And that's one of the things that I also have to be very careful about when I'm dealing with patients that are referred. I want to make sure that I've gotten that patient to the highest level of care in the beginning. I don't want a disaster sitting in my office and Rome is burning while good old Nero over here is fiddling. I don't want that. Let them get cleared out, and then they can come back to me, and I'll be happy to do a full evaluation. Part of the problem here was he'd already seen a neurologist, and the neurologist clearly didn't think much of it on the day he was evaluated. Now, whether or not he went back to see the same neurologist, because I had included that as part of my instructions to the other dentist, I don't know. I don't know if this was a new neurologist or not. But at least this patient was seen and they were taken care of. As apparently difficult it is to hear about a story like this, I have no idea if this is a tumor that is operable or will be treated with radiation or chemotherapy or any combination thereof. I don't know if it's benign or malignant, but it just goes to show what can happen if you don't have that radar antenna out. And I think that this is something that the docs should take a look at who are members of the site and keep it in the back of their mind. You'll see this is an old document. It's over 25 years old. It was typewritten. It wasn't done on the computer, and I've never had the need to change it. But I think it's worthwhile keeping it around so that you can know when you might be in trouble and get that patient out of the chair and into the best hands you possibly can for at least a preliminary screening and further workup as a neurologist would see to be necessary. Now, the third thing on the agenda today is just to briefly mention that I am going to do a segment on AIRE, which is the acronym for autoimmune regulator. It's involved in a few diseases I'd like you to know about. I suspect that a few people who are patient members on the site may have this disorder that's associated with a genetic mutation in the immune regulator gene. And I am waiting to get a new program so that I can incorporate it into PowerPoint presentations and do a really good job of doing the PowerPoint while it's capturing the video footage of myself and making it a little bit more interesting. So that's today's news. Sorry to have to discuss an issue like this with you, but I think it's important that you all think about some of the disorders that you have. Get to the right level of care first. Make sure that you're safe. That's the important thing. And then we'll go from there.